Hi, it's Karen Damshin with Damshin Financial Planning. And today we're going to talk a little bit about what happens with health insurance and Medicare when you're traveling this summer. So, travel season is in full swing. I'm so excited. Some of you have gotten out of our heat to go enjoy cooler climes elsewhere. So, first of all, you should know that your Medicare and your health insurance plans are required to cover you in the event of an emergency or urgent care anywhere in the United States. Okay, and you can access in-network facilities very simply by calling the member services number on the back of your insurance card, and they can give you directions based on where you are in the country for what services would be considered in-network. Now, when you go to one of those facilities, make sure you take your insurance card with you as well as a picture ID. They will probably require both cards before they will see you to treat you. And you do want to verify with the facility, either before you go or when you get there, that they are actually in network. Because whoever you called at your insurance company is just looking at a screen of providers. So you want to make sure that the facility that you go to or the doctor that you go to is in network and that they are not just willing to see you at out of network rates. Because if that happens, you could end up with some balance billing, and those bills can get expensive really quickly. So I also want to quickly cover what to do if you need to fill medications and you're out of state. So if you're traveling, maybe your suitcase gets lost and now you don't have your medications with you. So you need to know that even within the US, most insurance plans will not fill what are considered controlled medications outside of your state. And it may be difficult to get a doctor outside of your regular doctors to write you a prescription for controlled medications. So I always encourage you to make sure that you're carrying medications with you and they're not going through your checked luggage. Even if you are able to find a doctor and a pharmacy that will fill your medications out of state, they may only fill a few days at a time. So you may not be able to get a full 30-day refill. So if you're planning on an extended trip, maybe you're going multiple places or you're going to do a big road trip, make sure you're taking plenty of medication with you before you leave. And in the event that you're going to travel outside of the country, kudos to you. I can't wait to hear all about it and see your cool travel photos. But make sure that you are taking really good traveler's insurance with you. I'm going to include a link here that you can click on to go purchase traveler's insurance that will cover you very well in many places across the globe. But I encourage you to make sure you take at least $1 million worth of medical traveler's insurance coverage with you in the event that something happens to you and you are not in the good old US of A. So if you have any questions or you just want to tell me where you're headed, please feel free to reach out. I'd love to hear from you. I'll be back in your inbox again next week.